Hello, I'm Dr. Omar Bey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, we have another great one for you today. We have a show that we're going to talk about a topic called infectious disease. But before we get to that, let me talk about my favorite thing is caring and sharing. We're doing a lot on Facebook, Twitter, and Instagram. I'm posting up all the caring and sharing foods, helping you lose weight. I'm posting up inspirational messages. Go to Facebook, go to OBHealthy.com. That's the website, but just go to Obey Your Doctor on Facebook and Instagram. Check us out. We're there doing a lot of good things, all right? Remember our med moments too. Don't forget about med moments. Med moments are those times when you get that chest pain or you get that knee pain or your stomach's just a little upset. Your body's telling you something. It may be telling you that something's wrong. You should go see your physician anytime you have a concern like that. Don't hesitate. Go see your doctor. All right. Well, I want to do a Let's Talk segment tonight, and it's a one that I enjoy doing because I speak a lot out there about weight loss and obesity or being overweight and losing weight and the advantages that come about because you've lost weight or you're your ideal body weight. You know, there are many diseases that are associated with weight. All right, when you're obese or you are really overweight, and things like hypertension, diabetes, heart disease, they really come down. They come down as far as the amount of medications you have to take. So many things can improve if you lose your weight. So what I did was I developed a weight loss system, believe it or not. Okay, it's called Eat One Half. Eat One Half, make weight loss easy. And it's a personalized method to lose weight. Basically, it's an easy way that you can take the weight off that's healthy, very healthy. And you get to eat what you like to eat. It's very personalized. So it's flexible, a very flexible principle. Let's look at it. What I like a lot of my patients to do is I say, look at your plate. And if you decrease the high calorie foods on your plate, then guess what? You're decreasing the amount of calories that you're taking in. If you increase the low calorie foods on your plate, well, then that means that you're still taking in less calories as you eat your meal. So let's do it this way. Look at your plate. I want everybody to look at their plate because you know what you like to put on it. You know how much, either vegetables you like to put on it. You know how much spaghetti and potatoes or starches that you want to put on it. Well, cut the starches in half, just half it. Only take half of that. Your vegetables, increase it by 1/2. Just try that simple rule. It really, really works. It's so easy. The concept is easy, and the weight loss will start to come off if you decrease the amount of calories that you take in each meal. It really will work. Excellent, excellent. Well, our topic today, as I stated, is infectious disease. And we're going to talk about a particular program that's here in the Newark area. This is a health center, and the health center is called Newark Community Health Centers. And they're in Newark. They're based in Newark and the surrounding areas. And we'll talk about exactly where they're located once we get into the conversation. But I have the perfect person to talk about these programs at Newark Community Health Center. Her name is Richland Burnham. Did I get it right?
You got it right.
All righty. And she is the senior manager for infectious disease, the infectious disease program at Newark Community Health Center. Miss Burnham, welcome to our show.
Thank you so much, Dr. Bay.
All righty. I'm so glad that you could take time and come to the show because I know you're very, very busy. You're out in the community, you're doing your thing, and it's all so great. And you were telling me about this program, and I'm so excited about it. And I want the audience to know exactly what's going on there at Newark Community Health Center.
Sure, absolutely.
So let's start off with this. Why don't you tell me a little bit about this health center that's here in Newark? Is it? I know that you have the infectious disease program,
Yes.
but I understand there are a whole lot of other programs like there. Do they see kids or do they see adults? What's going on at this health center?
Newark Community Health Center is a FQHC. We're a federally qualified health center.
Oh, all right.
We're located in Newark and the surrounding areas, as you said, of Essex County. So we service all of Essex County.
Right.
We have 3 centers in Newark. One on Ludlow, one on 741 Broadway, and we just opened one in the Ferry Street area on 92 Ferry Street.
Oh my goodness,
And
down in the neck, down in North Newark.
That's in North Newark,
oh,
right.
Goodness, all right.
We also have health centers in 444 in East Orange, 444 William Street, East Orange, 37 North Day in Orange, and our Irvington site is 1150 Springfield Avenue.
Boy, you guys are all
So
over.
we like to say that we're covering all the areas of Essex County.
Oh boy.
Right.
So tell me about some of the specialties. You have internal medicine, so they have the basic doctors there.
That's right. We have
All right.
primary care,
Okay.
pediatrics.
Okay.
We have dentist, oral health, dental services at all
So
of our
people
sites.
can actually go there and get teeth repaired, and they can get all of the cleaning and all of that there as well.
We're a patient-centered medical home, so we like to say that we can. We're a one-stop shop, so you could come in.
You can come in and get it
it
all
all done.
All
That's
right.
And bring your children too, and they
So
can get
so
them
it's a
done.
family affair.
Absolutely.
All right. So you got to pull the husband along with you. All right.
The women have to bring the husbands and the children, the whole family.
He'll come kicking and screaming, but we'll have to bring him as well.
That's right. Yes.
All righty. Okay.
Yes.
Now, I understand that you guys service throughout I guess there are about 6 centers that you have.
We have 6
and you
centers.
service a whole lot of patients. It's almost like about 14,000 patients come through your centers a month. That's
Well,
what I understand.
That's right. Last year we serviced 44,000 patients in the year 2016.
Wow. What a great job.
Right.
What a great job.
Yes.
So, and the head of this organization, I should say, is Dr. Pamela Clark.
That's right. That's our CEO, President and CEO. Dr.
Oh boy,
Pamela Clark.
I hear she's a pretty powerful Jamaican sister.
She's dynamic in her. Yes, absolutely. We have to say that.
All righty. So, what I would like to do is just give me an understanding about the infectious disease program, and then we're going to isolate just one aspect that we're going to talk about as far as HIV.
That's
just
right.
tell me about it, program a little bit.
Sure. Our infectious disease program consists of all infectious disease we like to give education to our patients for. We service HIV, patients with HIV. We also screen for Hep C, Hep B, and we have grants and programs that support that as well.
Now, when you say Hep C, you're talking about hepatitis.
Hepatitis C and hepatitis B. That's right.
Because I know those two particular diseases have gotten a lot of play on TV lately.
That's
because
right.
there are certain medications that, if you diagnose it, there are certain medications that can really help these patients a lot. So the health centers actually are out there trying to grab these people and get the test done and make sure that they don't have it, because it can be a devastating disease if it's not caught early.
That's right. Hep C, they're seeing larger cases in the CDC. When I say they, are seeing larger cases of diagnosed Hep C, hepatitis C, especially the baby boomers. So we're trying to bring the baby boomers in for routine testing, and along with hepatitis C, we're screening for hepatitis B also, so that we can make sure that we're getting them quickly diagnosed and quickly treated. Because the best time to treat these diseases is in its early stages.
Right, and along with that also, the HIV test is given as well.
Absolutely, we have HIV, Hep C, Hep B, all as a routine practice. Best practice is a routine screening for those 3 diseases. Yeah.
You know, and it's so interesting now, because I remember years ago when I was training, we didn't have very good medications for any of those particular
Right.
diseases. Now we have excellent medications for
Very
those,
good medications, yeah.
for those diseases, and if we just know about them,
Right.
then we can put the patient on those medications and they do well.
Right. We have
Excellent.
more than enough services and support that can give patient education on the medications as well as if they do have the disease.
Right, right. What about now? I understand that this program, I'm talking about the HIV program, was started some time ago
Right.
by a physician. Tell me
Yes.
about tell me this story. Tell me this story.
Well, the story goes, one patient, one physician. So our 444 Williams site in East Orange, we had a physician by the name of Anita Vaughn. She was an internal medicine provider. There was a patient from Haiti who came, and she was diagnosed with HIV.
Right.
This was about 15 years ago.
Oh, goodness. All
So
right.
this was when HIV, I don't know if it was even called HIV at that time, when it was first brought to the forefront of the medical field, I'm supposing, I'm not sure. And there was no internal medicine doctor to care for HIV at that time
Right.
at 444 William Street.
Right.
Dr. Anita Vaughn was the person that that patient was referred to, and she was an infectious disease specialist, and she treated that patient. Once she treated that patient, more referrals came.
Right, the word
and
spread.
it built into what we have now, which is we ended the year last year with 493 patients, HIV patients that we serviced last year.
Oh, excellent, excellent. And that's throughout the city and
And this is
surrounding.
throughout the city
That's a lot.
and Essex County. Yes, that's right.
So one patient, one doctor.
One patient, one doctor.
And that's where it started.
And that's where it started.
Go
15
ahead.
years ago.
Give her. You have to give Dr. Anita Vaughn her props. I must
Absolutely.
admit, boy,
Yeah.
that's courageous.
Yes.
There's I don't know if it's the federal government or if it's the state government that gives grants that
That's right.
you apply for grants called the Ryan White Grant. Tell
That's
me
right.
about this, and that assists patients that have HIV.
HIV, yes.
Right.
Ryan White is a grant that's offered by the federal government, and we also have we also are a sub-grantee from the state of New Jersey. So,
Okay.
not the state of New Jersey, the city of Newark.
Of Newark,
So
okay.
we're a sub-grantee through the city of Newark, and we have Part C, which is direct funds from the government, from
Okay.
the federal government.
Right.
And this is for the assistance for each patient for their care and treatment. So these funds assist us in giving the best possible care to our HIV population.
Right.
We do this by following federal guidelines as it deals with the HIV treatment,
Right.
and we follow those guidelines on a day-to-day basis through our medical case management team.
Right. Now, the thing of it is that this money is, you know, and it just lets you know about the federal government, how important they feel this is, that they would
Absolutely.
have a particular fund or grant that you can apply for to service these patients and make sure that they get their medicine, make sure that they get family care, make sure that they get social care, they get psychological counseling, they get all these things just to make sure that these patients do well.
Right.
It's so important.
Well, Newark is one of the largest cities that is prevalent with HIV and AIDS. So we're in the hot spot, what you would like to say in regards to the high population of people diagnosed with HIV and AIDS,
Right.
and it's been like that for quite some time. So we take our job very seriously, and the patients who are here, we want them to know that they can live a very long and healthy life
Right.
with HIV. Once you are in treatment, you stay in treatment, you take your medications, and you do your yearly